Welcome to the BiblioBazaar podcast. In this episode, Dr. Paul and RN Nina take you through the topic of respiratory distress syndrome. This discussion is proudly sponsored by Nurse Unity Chats, connecting healthcare professionals for meaningful conversations. Let's get started.
Welcome to our HeyGen podcast. Today, we're diving into the fascinating world of neonatal respiratory distress syndrome. Let's jump right in.
Absolutely, I've been really curious about this topic. What's respiratory distress syndrome all about?
So respiratory distress syndrome, or RDS, is a condition that affects preterm babies.
Right.
It's caused by insufficient production of surfactant in their lungs.
Oh, surfactant? That's the stuff that helps keep the lungs expanded, right?
Exactly. Surfactant reduces surface tension in the alveoli, so without enough of it, the alveoli collapse, making it hard for the baby to breathe.
So this primarily affects premature infants then?
Yes, particularly those born before 36 weeks gestation.
Got it.
Their type 2 pneumocytes aren't mature enough to produce sufficient surfactant.
Interesting. What are some risk factors for developing RDS?
Well, besides prematurity, other risk factors include maternal diabetes, perinatal asphyxia, and multiple gestations.
Right. Multiple gestations like twins or triplets?
Exactly, because they often result in earlier deliveries.
Yeah. So how does RDS present clinically? What signs should we look out for?
It typically presents within the first few hours of life. The infant might show tachypnea, that's rapid breathing, expiratory grunting, nasal flaring, and sometimes cyanosis.
And those chest retractions, are they common too?
Yes. Substernal and intercostal retractions are common as the baby works harder to breathe.
I see. Wow, that sounds serious. So what's happening pathologically in the lungs?
Well, without enough surfactant, the increased surface tension causes the alveoli to collapse. It's like trying to keep a balloon inflated without tying it off.
Oh, that makes sense. So the lungs are essentially collapsing?
Exactly.
Yeah.
And that makes oxygen exchange really difficult for the infant.
Are there other factors involved?
Damaged and necrotic cells, along with mucus, line the alveoli, further impeding gas exchange.
Right. How is RDS diagnosed? Are there specific imaging features?
Yes. On chest radiographs, you'll see low lung volumes, diffuse bilateral granular opacities, and sometimes a bell-shaped thorax.
Interesting.
Air bronchograms may also be evident.
Air bronchograms, can you explain that a bit?
Sure. Air bronchograms occur when the air-filled bronchi are made visible by the surrounding collapsed alveoli. It creates this branching pattern on the X-ray.
Ah, I see. So those findings help confirm the diagnosis?
Exactly. But we also need to differentiate RDS from other conditions, like neonatal pneumonia or transient tachypnea of the newborn.
That's important. So how is RDS treated?
The mainstay of treatment is administering exogenous surfactant. It's given via an endotracheal tube, though less invasive methods are becoming more common.
And supportive oxygen therapy is needed too, right?
Yes. Oxygen therapy is typically required until the baby's lungs mature and can function adequately on their own.
Right. Are there any complications we should be aware of?
There are. Acute complications include persistent patent ductus arteriosus, pulmonary interstitial emphysema, and even pulmonary hemorrhage.
And chronic issues?
Chronic complications can include bronchopulmonary dysplasia, recurrent pulmonary infections, and subglottic stenosis.
Got it. Oh, that's proactive. But isn't surfactant deficiency only due to prematurity?
Actually, while prematurity is the most common cause, there are rare genetic disorders that affect surfactant production.
Really? I hadn't heard of that. So those cases would present similarly?
Yes, they present with similar symptoms, but might require different management.
I see. Can anything be done to prevent RDS?
Antenatal corticosteroids can be given to mothers at risk of preterm delivery to accelerate fetal lung maturity.
That's helpful. Is there ongoing research in this area?
Absolutely. Researchers are continually looking for better treatments and preventive measures to improve outcomes for these infants.
That's encouraging. So, if you had to summarize, what's the key takeaway about RDS?
Well, it's a significant condition affecting preterm infants due to surfactant deficiency, leading to collapsed alveoli and impaired gas exchange. But with timely intervention, the prognosis can be greatly improved.
That's a great summary. It's
Thanks.
amazing how advances in neonatal care have made such a difference.
It truly is. Saving these little lives is incredibly rewarding.
Absolutely. Well, this has been really enlightening.
I'm glad we could discuss it. Thanks
Yeah.
for the great questions.
Anytime. Looking forward to our next topic.
Me too, until then.